Thank you very much. Sorry, folks, I have a presentation over here, and I'm going to be speaking over here, so I'll do my best to kind of go back and forth. I have a very short presentation, so without further ado, I'm going to talk a little bit today about strategies to end homelessness. My name is Zach Brown. I'm the Executive Director of the West Virginia Coalition to End Homelessness. We're a statewide advocacy body on issues of homelessness in West Virginia. We're also the lead entity for what's called the Balance of State Continuum of Care, which is both a planning and funding entity for funding on homelessness and strategic planning in West Virginia. We're one of 4 continuums of care. There's another one in Wheeling-Weirton area, one in the Huntington-Cabell-Wayne area, and one in the here in the Charleston area. Looking at a little bit in terms of what we want to achieve going forward in eliminating homelessness in West Virginia, and we get a lot of questions about our title as an organization, and do we believe that we can end homelessness, and we indeed do believe that we can end homelessness. Looking at sort of down to the nitty-gritty of the problem, inside the data we collect, we see that 43 people have died in housing over the past 3 years. 5, maybe 6 people that we know of have died on the streets in West Virginia. These 43 people represent folks who are living in projects or have been living in projects around the state for the past 3 years. Right now, part of the problem is that we're managing homelessness versus ending it. A lot of that has to do with the way we're approaching and connecting the system of housing and care. Not in all cases, but in many cases. Go ahead. Solutions we're looking at is coordination amongst agencies, looking at a way to target resources, look at best practices in terms of the way people come into the system, not discharging people to homelessness, coming up with a logical next step scenario as to where they'll go if they do become homeless, or diverting them from homelessness in the first place. And by and large, a lot of the work that we do as a coalition is go around and speak directly to communities to try to come up with systems of care, systems of housing that lead to community ownership of the issue of homelessness, community by community. Talk a little bit about what the current situation is right now. And also in your packets, I've stayed away a little bit from the minutia of the data. I will cover that a little bit. There's a lot more of that in the packet that you have in front of you right now. Challenges and opportunities. We're looking at encouraging longstanding agencies to change their mindset as to how services can be provided. Looking at how things have been done for the past several years and looking at new ways that we can go about becoming more efficient. The past slide said that no one agency has all the services and all the housing available to cure all of homelessness, but together we have quite a bit of resources in West Virginia that if we can start to connect those dots a little better, we think that we can see a lot more success. Again, duplication and looking at how we can put the pieces of the puzzle together in such a way that if one entity is very good at housing and has a lot of housing resources and another is very good on the resource side, the services side, we can put those together to make more sense. And again, the issue of duplication. We're seeing already on the ground where coordination and collaboration is making a meaningful difference. One case in point is that for years, the 4 continuums of care in West Virginia were on 4 different databases. That meant if you were, for instance, in Wheeling, and you crossed that imaginary line that we have from Wetzel County down into, say, Morgantown, your life essentially started all over again as a client. We have all decided over the past year and a half to actually come onto, Mr. Dotson's with us today, onto the Huntington Housing Authority's a long-standing database. We've expanded that throughout the state. Point being, now we have one database where all client information goes into. We can pull one set of reports out of that. So that's one example on our end of where collaboration and breaking down of silos and breaking down of those imaginary lines has led to great success and is going to in the future. the desired state of things, where we would like to head. We're going to be implementing a campaign, a program called 100,000 Homes, and I would encourage you to Google that sometime. They have an excellent website. This process prioritizes by name and by face the most vulnerable folks, the most vulnerable people who are on the street that are most likely to die. It's a proven system. It's a proven campaign. It's worked. As you can see, it's housed over 70,000 people. 20,000 of those almost are veterans. We're actually going to have a boot camp for that on November 4th and 5th. And it's going to be a way that we can take this into communities and, again, in community by community, look at housing first, the most vulnerable people, the most chronic people. How can things improve? Well, by housing people. We know that it's roughly 4 times more expensive to leave people in the streets. What I mean by that is that, if a person stays on the street for long enough, their mind, their body, their situation deteriorates over time. We talk a lot about the cost of what housing and services are going to mean overall, but it's much more costly for people to deteriorate on the street. Unneeded law enforcement interdictions, crisis services, repeated visits to the ER, we all bear that cost. We bear that cost as a state. And there's a more effective, more efficient way to do that. That's through housing and stabilizing their housing. A lot of what we work on as a coalition, as an organization, is taking the lessons learned elsewhere, both from our own history and service, and both from other places in the world, looking at what has worked in other states, bringing that to West Virginia, and trying to change people's mindset in terms of what can be achieved. Go ahead. So what if we do nothing, or what if we maintain the status quo? Well, this is our feeling on that. The problem becomes worse. People will continue to be discharged into homelessness. Will pay a higher cost to no real effect, and more people will die on the street. That's an unfortunate eventuality of our work. And will continue to be so, and we think we have ways to mitigate that. What are we doing right now to change things? Again, working in communities to encourage change, to build a real system, to look at systemic issues that have existed for a long time that we can slowly begin to break down. To educate folks about resources and options. A large part of our work is to look at building and communicating to others what kind of resource exists. You would be surprised to know a lot of folks in a given county don't know what exists in another county over. So making sure that people know what the options are. And to encourage local ownership of the issue. It's one thing for us to be a state coalition, and it's one thing to have continuums of care in West Virginia that have their own jurisdiction and they work on homelessness as a group. It's another thing, especially in our case, where we have 44 counties, many of them in very rural areas. We encourage this to be a local issue, a local ownership issue, in order to solve it on that level. And there is only one cure to homelessness in the end, and that is housing. And looking at our affordable housing stock, how that can be expanded and how that can give us options, creative options for putting people affordably into housing with services. In looking at our numbers now and knowing that probably by and large we're to some degree undercounting the number of people that are out on the street in particular, it's very hard to count the folks that are out on the street in West Virginia for lots of reasons. We believe that the problem is solvable. We don't have the kind of numbers overall that we see in many other places, particularly urban places. So with the right strategies, we think that it is, homelessness as we know it is something that can certainly be ended. This is my conclusion. We have a lot of resources right now to make a real tangible difference. And again, I think a part of it is doing more of what works and less of what doesn't, less of what's been proven to work and more of what has been proven to work. Target our resources smartly before we start to sort of look and ask for more resources. I think taking a step back and looking at what our policies are now, how we're approaching things as a state, how we're approaching things as agencies, and looking at how we can be smarter with that before we automatically look at additional resources. And this is what we think we need. Prioritize those on the streets that are most likely to die, to mitigate the cost, both human and fiscal. We need to expand rapid rehousing in our state to look at ways that we can put people quickly into affordable housing, either who are on the street or at risk, and provide services for them, literally in their own apartment setting. Encourage shelters around the state to become true emergency shelters and help with this process of triaging people and then rapidly housing them, not letting instances of homelessness go on for long periods of time. And create a true coordinated assessment system. By that I mean ways to look at the way people come off the street, out of institutions, out of state hospitals, and look at sort of what their next most logical path is going to be and what service and what type of housing is going to be the most successful for them in the long run, so we can keep them stably housed and not have them cycle back out into the system again. And that's my presentation.
Good afternoon. I'm Mary Skeens, and I'm with Community Works in West Virginia. Community Works is a statewide nonprofit organization with 29 members whose purpose is primarily to provide affordable housing around West Virginia. And I'm here today representing a group who has been working for the past several years on a housing policy. And I am sort of coordinating that activity, but in your packet, you will find a copy of the group. In September of 2012, a group of individuals representing a wide range of housing-related entities came together to discuss the rising housing challenges in West Virginia, and combined with a decline in the federal support for all housing assistance. The group discussed the feasibility of a comprehensive housing policy in West Virginia and hoped to engage state government in improving housing outcomes for West Virginia households. Community Works agreed to coordinate the efforts and secured a grant from the Claude Worthington Benedin Foundation for the necessary support, research, and analysis to develop the policy framework. Using a neutral facilitated process, the group expanded their work to include federal, state, local, and private stakeholders in this housing industry and began meeting in February on a bi-monthly basis to develop components of a policy framework. Why make housing a priority? Adequate housing plays an integral role in the well-being and prosperity of West Virginia's individuals, families, and communities. When done well, it has the potential to provide an essential springboard for households all across the state to improve their economic situation and contribute to their communities. With the proper investment, it can play a critical role in the economic vitality and resilience of West Virginia's communities, stimulate economic activity, creating jobs, and fostering neighborhood stability. When housing is safe, decent, and affordable, it provides the stability that children need to do better in school, reduce exposure to stress, toxins, and infectious disease, and space within the family's tight budget to adequately invest in health care, food, and savings. Housing affordability and housing quality are significant challenges for nearly a fifth of the West Virginia households. To better meet the needs of the West Virginians for all backgrounds, including singles, families with children, seniors, disabled adults, and those transitioning out of homeless, West Virginia needs a healthy mix of housing options. This includes market rate as well as subsidized affordable housing, homeownership opportunities, and decent rental housing, single-family homes, and multifamily unit developments tied with services. To achieve this, West Virginia needs a clear, concise housing policy framework to guide its investments and make maximum use of its precious public resources. Consider these statistics. 30% of all children in West Virginia less than 5 years of age live in families with incomes below the poverty level. These families struggle the most to find safe, affordable housing. By 2030, the senior population of West Virginia is projected to increase by over 170,000 individuals, reaching nearly 25% of the state's population in 2030. As the number of seniors in West Virginia grows, so will the demands for new senior housing and for homes that will enable seniors to age in place. In 2009, almost half the West Virginia seniors in the lowest quintile of income spent at least 30% of their income on housing. About a third of the owner-occupied housing and a third of the rental units were built before 1960. More than 5% of the West Virginia's homes lack complete plumbing, more than double the national average. In your packet, you actually have a copy of the West Virginia Housing Policy Framework that we have developed over the period, and it contains four sections. In that policy, there are the 4 guiding principles that the group adopted in order to identify the needs in the housing policy. We developed 5 broad-range goal areas, 19 recommendations for consideration, and there's research and stakeholder survey results also available. That's located on your right-hand side of the packet. The guiding principles that we developed was that housing is an essential component of community and economic success and growth. Housing is inextricably connected to the well-being of West Virginia citizens and must be considered in state and regional local planning for transportation, education, health care, social services, and economic development. Investment in housing provides jobs and builds wealth. Quality housing is essential to neighborhood revitalization efforts and business development. Safe and affordable housing is essential to the thriving communities. Inadequate and unsafe housing affects everyone through devalued property and the cost associated with the recovery from fire and flood, health care, and poor housing market. All West Virginians should have access to adequate, safe, affordable housing. The state has a responsibility and obligation to its citizens to promote housing choice that allows all West Virginians to pursue economic and social opportunity that promotes health and well-being. A range of housing options should be available in the areas of the state. Many of West Virginia communities currently lack a diversity of housing options that includes quality single-family homes, rental units, and special need housing. Changing demographic characteristics must be considered in housing development. Affordability must be a policy priority. Many West Virginians are unable to afford safe and decent housing. Seniors on fixed incomes, persons with disabilities, the homeless, and many young families and low-wage earners are unable to secure quality housing. More than 1/4 of all homeowners with mortgages and a half of all renters pay at least 1/3 of their total household income for housing and are considered to be cost burden. A comprehensive housing policy is urgently needed. West Virginia currently lacks coordination and comprehensive statewide policy that encourages development of safe, affordable housing. Housing development is an important component of the economic recovery in West Virginia's growing populations of senior citizens. Requires the attention to be placed on specialized housing for this population. State housing policies should recognize and place high priority in making sure there is an adequate supply of safe, affordable housing. Nearly 1/4 of all housing units in West Virginia were built prior to 1950, and the median value of owner-occupied housing in West Virginia is only 57.2% of the national average. Housing policy must build on effective partnership and coordinated efforts across all stakeholder groups. State and federal housing programs need to be administered in coordinated fashion in order to achieve the greatest impact from the available resources. Local governments, housing organizations, and developers need to be supported in packaging sufficient financing for housing projects, particularly in rural areas of the state. Local partnership must be encouraged in order to promote a comprehensive plan, code enforcement, and housing development.
My task here today is to provide you with the actual goals and recommendations that came out of this study group, and we're hoping that you'll give serious consideration to what we're recommending. Policy Goal 1 is to raise the importance of housing in state government and promote accountability, effectiveness, and consistency in housing policy administration. Our recommendation here under this policy goal is to appoint a housing liaison staff person position within the governor's office. This position would promote efficiency, responsiveness to the needs of the housing community. Policy Goal 2 was to increase resources for housing development, preservation, and rehabilitation. There's several recommendations here to identify designated revenue sources at state level to fund flexible housing programs, provide incentives to increase private investment in housing, including promotion of public-private partnerships, promote and ensure that public funding decisions are consistent with state housing policy, identify land banking opportunities, expand funding sources for preservation and rehabilitation of existing housing stock, increase access to capital and technical assistance to nonprofit housing organizations. Goal 3 is to promote statewide planning, coordination, and integration of housing with other state improvement efforts. Our recommendations are to ensure planning for housing is integrated into economic development projects, workforce development, transportation, and education efforts, including new school planning and other related issues. This encourages local economic development authorities to include housing advocates in their planning. Encourage city and county governments to develop housing plans as soon as economic development opportunities are identified. The state consolidated plan, which is required by the U.S. Department of Housing and Urban Development, should be consistent with these guiding principles for housing policy. We're recommending support interagency collaboration in addressing housing needs, centralized, reliable statewide data, including housing implications on cost, market power, opportunities, and local demographic trends and moving trends to drive our decision-making. The policy goal 4 is to increase the quality and quantity of West Virginia's housing stock. The recommendations there are to recognize the issue of housing quality is a function of that nasty word, building codes. Replicate and grow best practice models in areas of rental rehabilitation programs. And our last and final policy goal is, the last is definitely not the least. It probably should be the first. It's as far as what is happening in West Virginia right now. Ensure that West Virginia can meet the housing needs of its senior, special needs, and homeless populations. Our presentation very much coincides with what Zach was telling you before. We would like to explore best practice models for replication to serve these populations. We'd like to foster more comprehensive collaboration between human service agencies and housing agencies. We need to reform existing state assisted living funding programs to expand access to non-institutional community housing options. We need to promote housing for special populations with accessibility and transportation resources. We need to address specialized housing populations re-entering our communities. This is both coming out of institutions, both criminal and mental and health. Adopt the 10-year homeless plan and activate the Interagency Council on Homeless. That's our final recommendation. Thank you, gentlemen, ladies.